I didn't do it.
Christine, are we good?
We're good.
Call to order the Ector County Hospital District Board of Directors Finance Committee meeting October 6th at 5 p.m. First on the agenda is review of minutes for September 1st.
Make a motion for approval.
I'll second.
Have a motion and second. Any discussion? All in favor say aye.
Aye.
All opposed? Motion carries. All right, at this time, if there's any conflict of interest with any of the board members that are on the finance committee, this is your time to disclose that. Hearing none, I'm going to move on. At this time, we have a section for public comments on the specific agenda items related to the finance committee today. If you would like to speak, this is your opportunity. Please state your name. Hearing none, I'm going to go ahead and move on. So we'll move on to the financial report for a month ended on August 31st.
Thank you. Okay, so we are looking at the financial presentation for the 11 months ending, so we've got one more month before we finish out our fiscal year. I think we're going to see a recurring theme in the various volume numbers. If you look here, we for our inpatient admissions, you can see our volume for the month was 1,059 admissions. It's the best of the last 5 months and is almost back to the March level. That being said, it's still 11% off of last year's numbers. But you can see a recovery in our inpatient admissions. On our adjusted admissions, we did not fare as well. We were slightly off, but we're still trending up higher. We're off 18.9%. As you'll see a little bit later on, our outpatient volume has not picked up to the fullest extent that our inpatient volume has. Average daily census is hovering right at the 160 mark. We were 161 for the month. You can see the last 3 months, 158, 161, 161. So that's about where we are. That's on a year-to-date basis, 9.8% off of last year's numbers. Our deliveries, we had a up from prior month, but you can see we're in that 170 to 190 range. Continue to do well. This time last year we hit 209. But on an ongoing basis, we're 6% up over prior year on the first 11 months, and on an annualized basis, 7.6. So we continue to see this service line growing for us. Total surgery cases, this is the one that we've stopped several times in past presentations and talked a little bit about. 662 surgeries for the month. As you can see, it goes up, it's come down a little bit. We were shut down a little bit in July. We came back in August. We still did not hit our number from last year. 942 was a very strong number this time last year. But if you go back and just look at the 5 months, April through August, compare this year to last year, we are roughly 35% off of prior year numbers. Our surgery volumes are that far under. Now, the good news is when we look at the month of September, and I know I'm reporting on August, but just to give you a forward looking on September, we had 760 surgeries for the month. So 760 is getting us a little bit higher than where we've been historically. And if you were to go back and just average these numbers from prior year, that's going to put us about 11 or 12% off of last year's numbers. So even though last 5 months we've been 35% off last year's numbers, we look at September, we're about 11, 12% off of last year's numbers. So we still have some opportunity for growth in surgery to get back to where we need to be. You can see on an annualized basis, we're 18.7% off of last year. but that's mainly just due to the volumes we missed as at the beginning of this pandemic. Here's another area of concern, and I think this is going to be our new normal for a while. ER visits, 2,916. We're 36% off of last year's number, and you can see we're hovering right around that 3,000 mark. We've made some really good improvements in our ER times, and I think that's helping with our overall throughput. But we're still in that 3,000 visits per month mark. The acuity is a lot higher than historically, but we just don't have the volume. And you can see on an annualized basis, we're 15% off of last year. Here's our outpatient volumes. You can see we're 23% off. Still, we're doing better. I mean, here's when we started this whole thing. For the month, we're 24% off of prior year. So we continue to have large variances to prior year on all of our service lines. Urgent care visits, I don't have an explanation of why we dropped back. I mean, we're better than these 2 months, but obviously below here. And it just may be the level of testing that went through in the month of August. ProCare, much like our other service lines, you can see we sort of come in around this level of 8,500 visits a month. We're at 8,662. That's 17% off of last year's number. Annualized, we're running right at 10%. So we're seeing anywhere from 10 to 15%, except in our ER visits, being off of the run rate. Now, when we look at staffing, we've been able to flex down the majority of our workforce, and we still have a large chunk of our workforce that's fixed. So we can't flex them to the fullest extent that we do our variable departments. And you can see we came in at 1782. That's 10% off of last year. We've had a little bit of creep from June to July to August, but we've also had some increases in our volumes. But this is something we're going to have to continue watching. We don't want to get anywhere back to this level. We need to stay in the 1750 range, 1750, maybe 1800 at most if we get our surgeries and inpatient volumes back. When we look at paid hours per adjusted patient day, we're at 28.2 hours. You go back and look at where we are the last 4 months compared to this same time last year, we're only slightly ahead of last year. So our efficiencies are there, especially when you consider built into this number is a large number of fixed departments. With our volumes being down like they have, for us to only see a slight increase in our paid hours per patient day is encouraging. Accounts receivable, we collected $19.4 million for the month. Yes, it's off of this green line, and we've talked about that. When I look at the last 3 months compared to the prior year, we're running right at 12% in cash collections off of the same time last year. Now I'm going to show you how that's tracking versus our gross revenue, but it is off, but it's not off significantly to what our gross revenue is doing. This, though, I will tell you, is one of the major points of discussion I had with RevWorks last week when they were here. We had a very frank conversation about their performance or lack of. They walked away with a clear understanding of our frustration with where they brought us over the last 9 months. I will tell you their trip, we had them and we had the new R1, which is the one that acquired them, it was their first trip out of the office. So both gentlemen that traveled, they hadn't traveled for the last 5 months, and we were the first client to come visit. So that sort of tells you the reason you know, they've heard. And I've got the guy from RevWorks, the lead person here, either Tuesday or Wednesday next week to provide their action plan, a detailed one on how we're going to get this back in shape. But they heard very clearly that we are very frustrated, and that we are also exploring options.
I got a quick question on that. My wife got a bill, I guess it's Thursday or Friday.
Yep.
Last week. You used to tell what doctor they went to see, how much the insurance paid. There was nothing on there but just what
Yes.
she owed.
Yep.
And a date.
And a date.
That's all it is.
And, yeah.
And I'm not real happy with that.
No, sir. No one is. And we've heard that multiple times, and we're speaking to them about how to get our statements
If they
back.
want their money, they're telling me what it's for,
Yeah,
just send me
yeah.
a bill.
They know how you're gonna pay when it's just a number.
Yeah.
And they want to see some detail.
Yeah,
Agreed.
okay.
And it's been part of our conversation with them. We've got to provide better. Not only do we have that, we have a whole bunch that just were very, very late.
This was from, July.
Well,
That's early.
yeah, that's early.
Yeah.
Yes, I got one. Russell showed me one about 3 weeks ago. He had from 2019. It's the first time he saw it. So, you know, these are all examples, and they're just us. We've got lots of people also talking to us about it.
Yeah, in my business, if a customer gets a bill from July and it's October, they're not gonna be happy people.
Yeah. No, we hear you, and that's
Okay.
that's part of our frustration about this whole thing. Is it's awful hard to collect when you give a bill to a person 8 months or 9 months after the fact, or in his case,
Not
a
even
year.
tell you what it was.
Yeah. So that right there, guys, I mean, you look at it,
And this is what they do.
that's the reason we're sitting here at 259 million in gross receivables. Because people have the same complaints. And that's what we're talking to them about. Revenue side, gross revenue was $100 million. If we go back and look at the 3-month time period, we were right at 13% off in gross revenue for the same 3 months that I was tracking on cash receipts. Cash receipts were off 12%, gross revenues off 13%. So that's tracking about where we need to be. The issue is all the old accounts that statements are now just coming out on. And that right there has the potential to turn into bad debt if we don't do something about it. Our net patient revenues, I first looked at this number and I had to question it. I went back and looked at the numbers, talked to Grant. With us to be off, to the extent we were off in gross revenues and on the volume numbers, we should have seen a 10 to 15% reduction off the prior year. But we had a significant dish payment made in this month of around $4 million. So you take $4 million off of that, and then you start looking at $4 million, that's $19.7 million we would have had versus 20, versus 22, versus 18. To put it back in line where we should be. So it's good that we got the dish money, but that isn't just true net patient revenues. It includes some Medicaid support money.
Hey, Steve, that was dish rep.
Dish rep, I'm sorry.
Yeah,
I said
Not
dish
not a
rep.
problem,
Dish
just
rep, thank you.
for clarification.
We're still tracking off last year's numbers, 8.6%. You can see it's up, but again, as I pointed out, the additional funds we got in there. Other revenue, we came in at 5.6 for the month. We had a budget of 8.3. That's 30% off. This typically is going to be our tax receipts, which is what we're seeing. Our sales tax receipts are anywhere from 25 to 35% off last year's numbers. And we've been running that way for the last 5 months. So that's sort of the new normal at this point as we bounce around at the low end of our sales tax receipts. Operating expenses, I will tell you, I am pleased just given where we are. We're 12% off in our salary, wages, and contract labor. Even though our paid hours per adjusted patient day has trended up a little bit, the largest part of this reduction in dollars is the reduction of contract labor. Now, we're having to incur some more contract labor now as volumes pick back up. But overall, you can see we were able to significantly cut our salary, wages, and contract labor during this time period. And good chunks of it came from contract labor, plus also some flexing of our employees. Employee benefits is off from budget in prior year. At this point, the budget included some numbers we needed for the pension, but we've been able to get those cleared up, I believe as of the end of June. Was that right, Grant?
Yes, sir. End of June, end
Yep.
of July.
So we aren't having to incur those expenses now, which is helping to explain for some of these lower expenses right now. Supply expenses have gone up a little bit. We are paying more primarily for our PPE, our protective equipment. Y'all heard me speak about the cost of masks, the cost of gloves, the cost of, everything has tripled, quadrupled, some things 10 times. And we're feeling that even though we've been able to manage it. We still have adequate inventories, but we're now in a period in which practically everything we're buying as it relates to keeping our employees and our patients safe is significantly higher than we were paying last year. Purchase services continues to do well compared to prior year. You can see the gap we've been able to maintain there. Total operating expenses are 13% off of last year, which is good. Yes, we've seen a slight increase. We need to be mindful of that and make sure that the increases are only there because of the volumes. Now this is a good slide, and even though these are small numbers, at least the small numbers in the right direction. So let's first talk about what we're looking at. We're looking at operating EBITDA, or in other words, our operating cash flow. The last 4 months, we were down, we were up, we were down, we were up. This month, we made $1.5 million in positive cash flow. If you go back and you add up these 4 months right here, I'm throwing April out because that's when we thought the world was going to end. But you put these 4 numbers together, basically, we had zero cash flow. And you're saying, well, how's that a good deal? Well, when you look at the same 4 months last year, you can see every one of these 4 months last year were negative. And you add up these 4 months, we lost $6 million in cash flow for the same 4 months last year, as opposed to these 4 months in COVID. Now, that's good news. So that means we've been able to manage our expenses to the extent needed with the pandemic here. That being said, we're still looking at a $12.9 million EBITDA loss for the year. And it will probably be closer to 13 or 14 when we finish out the year. Days cash on hand, we have done, I think, a good job of trying to ensure that we have adequate cash. You can see it's come down a little bit. We paid out, Grant told me before the meeting, and we were intending to, we paid out right at $17 million. About 7 of that was to get current with Cerner as part of our negotiations with them to reduce their fee like they did. We also got current with Texas Tech. So we paid out about $17 million in the month of September. That 17 will bring us below the 100-day mark, probably put us in the mid-90s. That'll still position us good going into the new fiscal year. We're going to be very cautious with our cash. This number does not reflect the $30 million we got last month from the advanced payment program for Medicare. They finally funded that. We've put that in a savings account. And at this point, what CMS is telling us is that we won't have to pay that back until August of next year, if we have to pay it back. Right now, every hospital is currently slated to have to pay back, but they've moved the time period instead of 4 months to a full year after you've got your distribution. So all those hospitals that got the money back in the April-May time period, they were thinking they were gonna have to start paying it back in the August-September time period. They moved that out a full year. We didn't get our funds until August, so we won't have to pay them back. But we put every bit of those dollars in an individual savings account. We're not planning on touching them unless something significantly happens. And I'm talking even after these 90 days of cash that we have. So we really have 90 days worth of cash.
What was the term on the repayment?
There's no interest on it. It's interest free.
Interest free over.
And then we will have to pay it back. Right now, they're saying up to 1 year. But what basically the way they'll recover it is that at the 1 year mark, then they'll stop paying our current Medicare claims. So as a Medicare claim comes due to be paid, they just do an offset. So you don't have to come in and make a payment. They just do an offset. So it could take us 3 to 6 months to pay it back over that same time period.
We thought it was gonna be, they were gonna let us have it for 4 months. I think you and I talked about this the other day. Then they brought that to the next year.
Yep.
So that's why we said, let's just hold on to it. If we can make a little cash in that time, that'd be great, but that's another 32 million on top of that.
Yeah. So we're positioned well to ensure that liquidity issues we don't have. Not all right.
Thanks, Steve.
This slide needs to come out. It's no longer relevant with our bond refinancing we did. And that is the financial presentation. Any questions? All right, thank you.
Make a motion if there's not any questions.
Approval?
I'll second.
I have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed, motion carries. And we have a consent agenda with several items on it.
I think one, so 2, A through E are just recommended agreements for approval. And then you want to go over each one, or you want to do them all at one time?
I make a motion for approval of all,
What did you say, all of them?
all of them.
I'll second that.
I have a motion and a second for to consider the consent agenda for A through E. Any discussion? All in favor say aye. Aye. All opposed, motion carries. All right, Mr. Collins. Have an agreement.
Mr. Collins.
Thank you. I don't have the agenda. Which one is on there first?
Education.
Software.
If you'll indulge me for a minute, I'm going to have some pen up. Okay, so what I have for you this evening is a pretty interesting thing. We had a team in our alignment when we had that activity live and going that was working on better communication about meds or prescriptions before people went home. And the team did a lot of work and they came up with several things, but one of them was this solution called Medication. And what it does is it integrates with the EMR, and when a patient is ready to discharge, it prints a fact sheet on the medication that is very, very easy to read. In fact, I gave you a sample of that. It's actually pictographs. So it kind of shows you what you're taking, when you're supposed to take it, how to take it, and what it does. And there are so many evidence-based studies out there that show when patients do take their medications and they understand them, there's much, much better outcomes as opposed to when they don't. So in addition, there are many questions on our HCAT survey that have to do with medication. And we are hoping, and we've seen other hospitals raise their scores in this area. During the hospital stay, were you given any medicine that you had not taken before? Before giving you any new med, how often did the hospital staff tell you what the medicine was for? before giving you any new medicine, how often did hospital staff describe possible side effects in a way you can understand? And when I left the hospital, I clearly understood the purpose for taking each of my medications. So we're hoping it's one push of a button. The EMR kind of aggregates all of the meds the patient is on. It prints out this fact sheet, and then the clinical staff are able to use that as a tool to help explain this to the patients. So even better news here, the foundation has agreed to fund the majority of this. So it's a $30,000 a year request. Foundation will fund most of that the first year, and then the hospital will pick that up in years 2 and 3. Any questions about this?
How much are they funding this year?
I think it is $30,000.
Questions for Matt?
I'll make a motion to,
Second.
I have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed? Motion carries. Now we've got the approval of the Paramount Health Solutions Agreement, Mr. Ewing.
Okay, so as part of our clinical documentation improvement department, in which we review the medical record in concurrent time as a means of being able to ensure that it's being documented accurately. We want to bring in a service that will go back and look retrospectively at the last 2 months worth of in-house claims and determine if we have documented them properly so that they can be coded properly. And if we haven't, then they will help create the queries to ask the physician so that we could get the bill correct. This is a retrospective review. This company has done it for numerous other hospitals within our purchasing group, TPC. They charge $160 a medical record, and they give us a guarantee that if they are unable to find what they charge us in recovery, then we won't be billed for it. So it's basically a worst case scenario, a net zero cost. Best case, we should pick up a little bit, but more importantly, on a go forward basis, we're able to take the education from their audit and then turn that into future queries with our physicians to ensure that we have better documentation. It should total roughly $196,000 or less in fees if they do every record over the last 2 months. I don't expect them to, but I did put in the maximum amount. And what I'm hearing back from my CFO peers in the other TPC hospitals that have already used this vendor is anywhere between 150 to 250% return on investment just on the initial. So I think it's a very low risk expense for us, but it is greater than the $50,000, and so that's why I bring it to the board.
Any questions? Entertain a motion.
Make a motion for approval.
I'll second.
I have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed? Motion carries.
Thank you.
Hearing Screening Associates Agreement.
Currently, all of our newborns have to have a hearing screen. It's a state mandated thing prior to them being discharged from the facility. And then as a state requirement, we have to also provide a follow-up for anyone that does not pass those hearing screens by referrals to audiologists and things like that. Currently, we use a pediatrics hearing screen group. And while Mr. Ewing challenged us to look at all of our purchase services, this was one of those. And so we found, although it may only be about a $4,800 savings, it is a little bit. And so I'm proposing tonight that we switch over to a Hearing Screen Associates. It's a new company. They will be continuing the same services that the current company offers, state reporting, follow-up. They have multiple languages so that we can have great service excellence during those hearing screens with parents. And they brought the cost down to $100,845. So I'm just requesting that we switch to this company.
What about the quality there? I mean, is it just as good quality that,
It is, they're gonna turn in exactly the same state metrics. We have a report card every month to show where we're at and if we're meeting the state requirements for our hearing screen program. And thus far, we actually started seeking out other companies just because the current company that we use, they haven't been providing the follow-ups to the things that we've asked them to do, and so they haven't been meeting those quality metrics. I do feel confident that these will do that.
Is it time for renewal, or we can have a penalty for moving?
Yeah, it is a renewal. We've already sent them a letter with our intent to terminate the agreement.
Okay.
Make a motion for approval.
I'll second.
I have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed, motion carries. All right.
Got another one.
You want me to go ahead and do mine?
Yes.
You're next.
The second piece that I have this evening is a request to purchase a urology table with x-ray capability. The current one that we have in the unit for surgery, it's actually reached its end of support status back in 2018. So our biomed department, we've been kind of piecing things together, trying to make it work. So we've actually invested money into it that doesn't even have value for. This is actually our second notice of we're not going to support you that we've received, and there's no longer any spare parts. Our TriMedics company for biomed, they actually went out and found a very, very old computer that probably it's just not supported, and they couldn't even get it to work with that computer. They did get the table working recently, but with the patient on the table, it's getting to where it works. But then we get in the middle of a procedure and we have to kind of mess with it to keep it working. So I'm proposing that we purchase a new urology table for $378,591.
I'm sure this should have been done in 2018.
This right here is just a really clear example of how much this organization has stretched the existing surgical equipment we have to the extent that sometimes we're spending money when we really shouldn't be spending money. $400,000 is a lot of money to have to pay, but if we don't, we're not going to be able to do the type of procedures that this hospital should be able to perform. So we really do need to do it. Cost justification wise, I didn't even run through it. It is a standardized piece of equipment.
It is,
Needed.
it supports 8 positions.
Yeah.
And then, Madam Chairman, not all due, what do you call it?
Process.
Yeah, but, when you're being clear about something.
Transparency.
What?
Transparency?
Transparency, thank you. Sorry about the measures. They did come to us and ask us if we would sign a PO, we could save another $15,000 off of this. And I did execute that PO a couple of days ago because we saved us another $15,000.
It's actually 20,000.
Now here, 25.
Go 50.
The original was 390,000, and they said if you'll give us the PO promising to purchase, we'll go ahead and.
In that case, I'll make a motion to approve it.
I have a motion and a second. Any discussion? All in favor say aye. Aye. All opposed, motion carries.
Thank you, David. That keeps me out of trouble. I appreciate it.
Yeah.
Well, and that's why I said this needed to be done in 2018. I know it's a lot of money, but
Yeah.
I mean, we're playing catch up here, so.
Yeah, thumbs up.
All right, Mr. Collins, your last one. Emergency purchase for an elevator. I do not want to get stuck on an elevator. All All right.
Approved.
That is like my biggest question.
Okay, this is pretty simple. It's called unit number 13. This is our elevator that goes between the ER, the ICUs, and surgery. It was installed in 1997. I'm not sure it was a great elevator to begin with, but it has given us constant problems over the last 3 to 5 years, and is in desperate need of what we call modernization. It's not a complete replacement of the elevator, but it does replace all of the critical components, control boards, cab, all of that. ThyssenKrupp has given us a price of $168,198 to do that. We did put in $25,000 for your approval for contingency because we don't know everything that we're gonna find when we get in there and start deconstructing it to redo it. So
It's
with
in
that,
very bad shape.
it's very bad shape. It is actually frightening to ride in it because it rattles and shakes, and we have had patients and staff members try. So it's time.
You say the cab, is that the box you get in, they're gonna replace that?
They're gonna refurbish it. It's not a complete replacement, but it'll look better, sound better, and work better.
So we thought about selling rides on this for Halloween. But if you ever want a weird feeling getting that elevator when the door opens and the floor you're trying to get off on, hits you about waist high.
there.
Yeah. Or you're off on.
No.
Make a motion for approval.
I have a motion and a second. No discussion. All in favor say aye. Aye. All opposed, motion carries. Before we're adjourned, Steve, do I need to do a roll call? I forgot to do that at the beginning.
Couldn't hurt.
For minutes, okay. So I apologize, I started going and didn't do a roll call. So I'm gonna do a roll call really quick for our minutes. David Dunn,
Here.
Wallace Dunn,
Absent.
I'm here.
Dr. Davenport.
Here.
Dr. Benton.
Here.
Mr. Tippin.
Here.
And Mr. Ewing.
Here.
And Bren is here. All right, with that, we'll adjourn.